Welcome to Nursing Matters by the RN Network, the podcast where we dive into the latest news, trends, and career guidance for nurses. Each episode brings you insightful interviews and discussions with key leaders in healthcare, exploring the issues that matter most to nursing professionals today. From navigating your career to understanding the changes shaping the nursing landscape, Nursing Matters is here to keep you informed and inspired. So North Carolina has been in the news a lot in the past few weeks after Hurricane Helene. But did you know North Carolina is home to UNC Health, an award-winning not-for-profit integrated healthcare system? Nurses, you're invited to apply to join an inclusive organization with over 40,000 employees dedicated to improving the well-being of the communities they serve. UNC Health has been named the top-ranked healthcare system for women in the entire Southeast and recognized by Fortune as one of America's most innovative companies. UNC Health's nurses are leaders in quality care, knowledgeable experts in diverse specialty fields, and innovators of visionary solutions to the many challenges professional nurses face today. They offer opportunities for advancement, collaboration with shared governance, and recognition of staff accomplishments to support nurses in providing complete care for patients and families. To learn more about UNC Health and apply, visit jobs.rnnet.org and click on UNC Health. That's jobs.rnnet.org for more information. Hey everyone, welcome back to Nursing Matters. I'm Christina Archer, and today we have a packed episode with some really fascinating stories. We'll be talking about everything from the growing role of AI in healthcare to how calisthenics could be the fitness routine you didn't know you needed, plus insights on nurse compensation trends, the importance of nurse case management, and more. So whether you're driving to your next shift, grabbing a quick coffee break, or just relaxing at home, stay tuned because we've got a lot to cover. Let's dive in. First up, let's talk about artificial intelligence in healthcare. According to an article from Modern Healthcare, AI in the medical field might not be living up to the immense hype surrounding it, and the cost of implementing these advanced technologies is raising some eyebrows. While AI has promised to revolutionize diagnostics, treatment plans, and administrative tasks, it seems like we're still in the early stages, with healthcare systems struggling to fully integrate these tools effectively. So the article notes that the upfront costs of AI combined with the lack of clear regulations are creating barriers for hospitals and clinics that were hoping to streamline processes and improve patient care. This is a huge issue because despite all the buzz about AI transforming healthcare, we haven't seen widespread, tangible results yet. What's even more alarming is that the over-reliance on AI can introduce risks if these tools aren't properly calibrated or integrated with clinician workflows. For instance, the Journal of American Medical Association recently published a study indicating that misinterpretations of AI-driven diagnostics could increase liability concerns, making healthcare providers wary of adoption. For nurses, this presents both a challenge and an opportunity. On one hand, you've got these tools that promise to ease the administrative burden, giving nurses more time for direct patient care. But on the other hand, as frontline caregivers, nurses are often the first to spot when something doesn't seem right with a patient's treatment. AI might give you data, but human intuition and critical thinking are still absolutely irreplaceable. Nurses need to be both advocates for their patients and savvy enough to work alongside AI technologies without becoming too dependent on them. So while AI has a long way to go before it becomes the game changer we're all hoping for, it's clear that the role of nurses in managing and interpreting AI-driven healthcare will be crucial. Now let's switch gears a bit and talk about fitness. Here at the RN Network, we're all about self-care for nurses. According to an article from Harvard Health, calisthenics are making a big comeback as an accessible and effective way to stay fit. Think push-ups, squats, lunges, and planks. These body weight exercises don't require fancy equipment or a gym membership, and they're incredibly versatile. What I love about calisthenics is it's so approachable, especially for nurses who are often on their feet for long shifts and may not have the time or energy to hit the gym. The beauty of calisthenics is that you can fit it into your day in small bursts. The article highlights how just 20 minutes a few times a week can improve muscle tone, flexibility, and endurance. A study published in the British Journal of Sports Medicine found that people who incorporate bodyweight exercises like calisthenics into their routine had significantly better strength and mobility compared to those who rely solely on cardio. For nurses, staying fit is crucial, not just to your physical health, but to your mental well-being too. I mean, after a long day of patient care, sometimes the last thing you want to do is work out, but calisthenics could be a great way to keep your body moving without the extra stress. Plus, it's cost-effective. You can do it anywhere, anytime. So if you've been skipping workouts because of time or cost, this may be your new go-to. Let's dive back into the tech side of healthcare for a minute. Becker's Hospital Review recently published an article highlighting concerns about the lack of regulations surrounding AI and MyChart and other patient portals. MyChart, which is widely used for managing patient health information and communication, is incorporating AI-driven features like symptom checkers and automated messaging. Sounds helpful, right? Well, here's the catch. There's no real regulation on how these tools are being developed or how accurate they are. The article points out that because these tools aren't classified as medical devices, they don't have to meet the same regulatory standards as other healthcare technologies. That means there's a potential for errors or miscommunications that could have serious consequences. Imagine a patient misinterpreting an AI-generated message and not seeking care when they really need it. This is something that really needs to be addressed as AI becomes more ingrained in patient care. From a nursing perspective, this is where vigilance is key. Nurses are often the bridge between patients and technology, so being aware of the limitations of AI and platforms like MyChart is critical. You're the ones who can clarify any misunderstandings and ensure that patients aren't relying too heavily on automated responses for their healthcare decisions. It's another example of how, while technology is a helpful tool, the human element remains absolutely essential in healthcare. Nurses, are you ready to expand your professional network, build meaningful relationships, and engage with fellow nurses from all over? Join the RN Network online community on LinkedIn. It's the perfect place to connect, share experiences, seek advice, and even post your own insights. Whether you're looking for career advice, job opportunities, or simply want to be a part of a supportive nursing community, the RN Network has you covered. Ready to join? It's easy. Visit rnnet.org/LinkedIn-groups to sign up and become part of a thriving community of nurses just like you. Again, that's rnnet.org/LinkedIn-groups. Don't miss out. Network, engage, and grow with the RN Network today. Okay, here's an exciting development. Cleveland Clinic, one of the top healthcare providers in the country, has just announced a partnership with Amazon's One Medical, according to Becker's Hospital Review. This collaboration is aimed at improving primary care delivery by leveraging One Medical's digital-first approach. For those unfamiliar, One Medical offers membership-based primary care with an emphasis on easy access and streamlined virtual visits. So why is Cleveland Clinic interested in this partnership? Well, the article suggests that the future of primary care is all about convenience, and combining Cleveland Clinic's renowned clinical expertise with One Medical's tech-driven model is a step toward providing more personalized and accessible health care. This could be a game changer, especially as more people opt for virtual healthcare services. For nurses, this partnership might signal a shift in how primary care is delivered, with more integration of digital tools to streamline patient care. As healthcare continues to shift toward more tech-enabled solutions, the role of nurses could evolve to include more telehealth and virtual care interactions. While that might sound a little daunting, it's also an exciting opportunity to expand your skill set and be at the forefront of modern healthcare. Up next, let's talk about something that's critical for patient outcomes, but often flies under the radar: nurse case management. Minority Nurse published an article recently making a compelling case for the importance of nurse case managers, particularly in managing chronic illnesses, complex cases, and coordinating patient care across multiple providers. Nurse case managers are responsible for assessing patients' needs, creating care plans, and making sure all aspects of a patient's treatment are being addressed. They also serve as advocates, ensuring that patients understand their treatment options and have access to the resources they need. The article highlights the growing demand for case managers as healthcare becomes more complex and patient populations age. What's interesting is that research from the Case Management Society of America has shown that patients who have a dedicated nurse case manager tend to have better outcomes, lower readmission rates, and improved satisfaction. This is a specialized role that really demonstrates the depth and breadth of what nurses can do beyond the bedside. If you're a nurse looking to take your career in a new direction, case management might be a path worth exploring. I want to take a quick moment to remind you that Election Day is just over 2 weeks away. It's hard to believe. Voting is one of the most important ways we can have our voices heard, not just for ourselves, but for our communities and the future of healthcare. As nurses, you see firsthand how policies affect patient care, public health, and the healthcare system as a whole. So if you haven't already, make sure you're registered and mark your calendar to cast your vote. Your voice truly makes a difference. Here's an interesting story that's really been making waves. A new study covered by the New York Post suggests that Ozempic, a drug commonly prescribed for type 2 diabetes and weight loss, might also lower the risk of Alzheimer's disease. The research indicates that the drug's ability to reduce inflammation and improve blood sugar levels may have protective effects on the brain. How exciting is that? Because Ozempic has become so popular recently and it's all over social media. So think about it. It's already being widely used to manage diabetes and help with weight loss, but now it could prevent Alzheimer's. The study, which still requires more research before any definitive claims can be made, suggests that reducing inflammation and stabilizing blood sugar levels can decrease the likelihood of developing Alzheimer's. This could have massive implications for both diabetes management and cognitive health in aging populations. For nurses, especially those working with elderly patients or in long-term care facilities, this could be a game changer. If further studies confirm these findings, Ozempic could become part of a broader strategy to manage not just metabolic conditions, but also neurodegenerative diseases. It's important to keep up with research like this because as frontline caregivers, nurses will often be the ones discussing medications and treatments with patients. Understanding how medications like Ozempic might offer additional benefits could help nurses better educate and advocate for their patients. This study is a reminder that healthcare is always evolving, and medications initially developed for one purpose may end up having far-reaching benefits. Staying informed about these developments is key to providing the best possible care and having those important conversations with patients about their long-term health. Before we wrap up today, I want to talk about something that's close to the heart of every nurse, building confidence as you start your first job. We all know that transitioning from nursing school to the real world can be very intimidating. The RN Network recently published a great article offering practical strategies for new nurses to not just survive, but thrive during this crucial time in their careers. The article highlights several key strategies, such as seeking mentorship, embracing continuous learning, and practicing self-care to avoid burnout. One of the most important points is finding a mentor early on. A mentor can offer support, answer questions, and help you navigate the complexities of your new environment. They've been in your shoes and can offer invaluable guidance that textbooks really just can't provide. In fact, research from the Journal of Nursing Education shows that nurses who have strong mentorship relationships early in their careers report higher job satisfaction and lower stress levels. The article also emphasizes that confidence builds over time and that it's totally normal to feel overwhelmed in the beginning. New nurses are encouraged to take things one day at a time and not hesitate to ask for help when they need it. Nursing, of course, is a team sport, after all, and everyone around you has had their first day at some point. Being open to feedback and understanding that mistakes are part of the learning process can help ease those first-year jitters. For nurses starting out, it's also important to focus on self-care. The emotional and physical demands of the job can be tough, and taking care of yourself is key to staying healthy and engaged in your work. The article gives some great tips on managing stress, like setting boundaries, getting enough sleep, and practicing mindfulness techniques. Overall, this article offers some solid advice for anyone beginning their nursing journey. It's okay to not have all the answers on day one, and building confidence takes time. The most important thing is to stay committed to learning, lean on your support system, and remember, every nurse started exactly where you are now. Let's take a moment to focus on a group that often finds themselves stretched thin: working parents in healthcare. An article from Success breaks down the key benefits that employers should offer to support working parents, and it's especially relevant in the nursing profession, where long shifts and unpredictable schedules can make work-life balance even harder. According to the article, some of the most essential benefits include flexible work schedules, paid parental leave, access to affordable childcare, and mental health resources. For nurses who are also parents, these types of benefits aren't just perks, they're literally lifelines. Balancing patient care with family care can be overwhelming, and without the right support from their employers, many working parents face burnout or may even leave the profession altogether. One thing that really stood out to me in this article is the emphasis on mental health support. Working parents, especially those in high-stress jobs like nursing, need access to mental health resources that go beyond the standard Employee Assistance Program, or EAPs. More and more companies are offering expanded counseling services, stress management programs, or even on-site childcare to help ease the burden on working parents. For healthcare organizations, offering these benefits can have a positive ripple effect. Not only does it improve employee retention, but it also contributes to better patient care. When nurses feel supported both at work and at home, they're more focused and present on the job. So if you're a working parent in nursing, don't hesitate to advocate for these types of benefits. They all make the difference. Remember, you can't fill someone else's cup when yours is empty. Next up, let's talk money. Diversity Nursing recently published an insightful article on nurse compensation trends to watch for in 2025, and there's a lot for nurses to consider as they plan their career paths. With the ongoing nursing shortage, wages are continuing to rise in an effort to attract and retain talent, but that's just the tip of the iceberg when it comes to compensation trends. According to the article, one of the most noticeable shifts is the increased focus on bonuses and incentives. More hospitals and healthcare systems are offering sign-on bonuses, retention bonuses, and even referral bonuses to keep their nursing staff intact. In 2025, we're expected to see even more competitive offers, with organizations tailoring their packages to address local and regional demands. For example, rural healthcare systems may offer substantial bonuses to offset the challenges of attracting nurses to less populated areas. But it's not just about salary and bonuses. There's also a growing demand for better work-life balance and comprehensive benefits. Flexible scheduling, increased PTO, and even tuition reimbursement are becoming more common in compensation packages. It's clear that nurses are looking for more than just a paycheck. They want a career that supports their personal and professional growth. As the demand for skilled nurses continues to rise, now is a great time to be proactive about your career. Keep an eye on these trends and don't hesitate to negotiate for the benefits and compensation that matter most to you. Whether you're a new grad or a seasoned nurse, understanding the trends in nurse compensation will help you make informed decisions about your future. Next, let's tackle an incredibly important issue: reducing maternal mortality and the vital role that nurse midwives play in making this happen. Diversity Nursing recently published a powerful article that highlights the critical contributions of nurse midwives in addressing the alarming maternal mortality rates, especially among women of color. According to the CDC, the U.S. has one of the highest maternal mortality rates among developed countries, and the numbers are even more devastating for Black and Indigenous women. The article makes a compelling case for nurse midwives as an essential part of the solution. Nurse midwives focus on holistic, patient-centered care and often have more time to spend with expectant mothers, which allows for better education, support, and early detection of potential complications. Research has shown that outcomes are significantly improved when nurse midwives are involved in maternal care. Their emphasis on continuous support, patient education, and advocacy makes a difference in preventing complications that could lead to maternal deaths. In fact, studies from The Lancet show that midwifery-led care can reduce maternal mortality by as much as 83% in low-resource settings, and it can have a significant impact in developed countries as well. For nurses considering a specialization, midwifery offers a rewarding career path that directly improves the lives of mothers and babies. As healthcare shifts more towards patient-centered care, the role of nurse midwives is becoming increasingly recognized as a crucial element in tackling the maternal mortality crisis. It's not just a job, it's a mission to save lives. And that's a wrap on today's episode of Nursing Matters. From the potential game-changing impact of Ozempic on Alzheimer's disease to the essential role of nurse case managers in improving patient outcomes, we've covered a lot of ground. We also explored how AI continues to influence healthcare, both in terms of its promises and its challenges, and why fitness routines like calisthenics are perfect for busy healthcare professionals looking to stay fit without breaking the bank. The stories we've discussed today remind us that nursing is about so much more than bedside care. It's about being involved in every aspect of patient care, whether that's navigating new technology, supporting public health initiatives, or managing chronic illnesses. Nurses truly are at the heart of the healthcare system, and staying informed on these topics helps you continue to make a difference. Thank you so much for tuning into Nursing Matters, brought to you by the RN Network. If you found today's episode helpful, don't forget to subscribe, share it with your colleagues, and leave us a review. We'll be back next time with more news, insights, and trends that impact the nursing profession. Until then, keep up the great work and stay informed.